This is Chicago's very own WGN Midday News.
Coming up next, what you don't know about oral cancer. We're learning about this deadly disease and how you can prevent it.
Welcome back. In today's Focus on Family, it is Oral Cancer Awareness Month, and dentist Dr. Margaret Mitchell joins us. Thank you so much for being here.
Thank you so much for inviting me. I have
oral cancer, not a cancer that we talk about very often. How common is it?
Unfortunately, the U.S. population this year will be diagnosed with oral cancer.
That's unbelievable. Who is most likely to get it?
Well, most likely it's a person that's over 50 years of age. Typically, there's a history of tobacco use.
Right.
But we're seeing, unfortunately, 25% of the population that's diagnosed doesn't have any of these previous...
So like lung cancer, you don't have to have smoke to get it.
Right.
Okay. Why is the death rate so high?
Well, it's subtle. It's hard to find. It's hard to see, and unfortunately, it's not detected usually until the later stages. By that time, it's metastasized to other areas, and then the prognosis is really just about 50% over the next 5 years.
Now, you brought some information along with you, some pictures that we want to take a look at. We've got some information. There we go. Can you explain that, Dr.
Yes,
Mitchell?
I wanted to show people that these are subtle things that you really couldn't really see in your own mouth. If you look on the left side of the screen, you'll see that little kind of red dot over there. To most people's eye, that's absolutely nothing. That's why it's important for your healthcare provider to be looking in your mouth.
What is that?
That is oral cancer.
That's the big, okay, all right.
That is oral cancer.
What do we have up next, please?
This is on the side of a person's tongue. Most people wouldn't even really see it. It's that white sort of area along the side of the tongue, and that, again, unfortunately, is oral cancer.
Okay, next, please. Do we have another picture?
We do, and if you'll see that gold crown right above to the right, that little red spot there, that almost looks like somebody would have bit their cheek. If something like that, if I would see something like that, in 14 days, I would definitely have the patient back to make sure that that is gone, because unfortunately, that lesion is oral cancer.
Okay, do you have any more pictures?
Basically, I just brought those three.
Okay, all right, good deal. Are there signs or symptoms that we as patients can look out for?
If there's something in your mouth and it's not gone, a lot of people get cold sores, a lot of people get herpes. If there's something there that's in your mouth that's not gone within 14 days, because all these things should clear within 14 days, go see your healthcare provider.
I get these little bumps on my tongue sometimes that my mother used to tell me were lie bumps. If you told a lie, you'd get one. I mean, is something like that reason for alarm?
If something isn't gone within 14 days, what my philosophy is, we want to find out what it is and why it's persisting.
Okay.
There's many things that we can do. First of all,
quit smoking, stop using tobacco,
The other thing is very definitely have your healthcare provider do a thorough exam on a yearly basis. It's not scary, don't be afraid to look.
Doesn't hurt.
Doesn't hurt, and don't be afraid to have somebody look. It's very important for your healthcare provider to be wearing magnification, loupes so you can see, basically gloves, a mirror, mouth mirror, and then most importantly, taking a piece of gauze and pulling your tongue out. Okay? Feeling the side of your tongue, looking in the floor of the mouth and looking in the back of the throat and actually feeling for any kind of lumps or bumps.
No, before we go any further and before we run out of time, I want you to talk about what HPV and how that's related to oral cancer.
Unfortunately, HPV is the human papilloma virus. We know that many viruses do cause cancer.
Right.
The HPV 16 and 18 cause cervical cancer.
Okay.
The HPV 16 causes oral cancer.
All right, so you recommend that women get the shot to help prevent oral cancer as well?
Absolutely.
And what about for men? Should they get the shot
We say
as
that
well?
Also, because it can also cause venereal warts, and it can also cause the oral cancer.
Okay, is there anything down here you want to mention quickly? Because we're just about out of time. Very quickly.
If something is seen in your mouth that looks suspicious, don't be afraid. Don't be afraid to go to see somebody, to have somebody look. We can take a brush biopsy, send it into a lab. They can tell us if it's something that needs biopsy. The other thing that dentists can use sometimes is a Velscope. This is a light that will show a difference in fluorescence of tissue.
Okay, so that's just another technique that you have. Dr. Mitchell, I'm so sorry, but we're out of time. Thank you for joining us.
Thank you, Allison.
Very important information. To learn more about the dentist tips and get some advice, you can check out her website. It's mitchelldentalspa.com. For a link, log on to WGNTV.com/midday.